Hello and welcome to Quick Anatomy Hub. This is a tutorial about the normal anatomical terms of human body. For that, first we have to discuss the normal anatomical position. It says that, like in this image, the body is erect, facing forward, with palms facing forward, and the knees and toes are pointed forward also. So, whenever we talk about anatomical terms or planes, we should talk about them in reference to this a normal anatomical position. Now, here we have the anatomical terms. First, we have the term the anterior and posterior. Anterior means the structure which are closer to the front of the body, and posterior are related to the structures which are closer to the back of the body. For example, sternum is anterior to heart, and vertebral column is posterior to heart. Next, we have medial and lateral. Medial is closer to midline or mid-sagittal plane, so the structures which are nearer to midline are called medial structures, while lateral is related to away from midline. So the structures which are away from the midline are called lateral structures. Like little finger is a medial structure, while the thumb is a laterally present in anatomical position as we have discussed. Or the radius is lateral and ulna is medially present in forearm. Next, we have superior and inferior, which describes the structures and vertical axis. The superior is towards the top, and the inferior is towards the bottom. So, for example, the face is superior to chest, and knees are inferior to chest. Another term that is used quite a lot is superficial and deep. It's not shown here, but we should discuss it here. Superficial means the structures which are close to the surface or skin of the body, and deep means further away from surface of the body. As abdominal muscles are superficial when compared to the viscera like stomach or intestines, which are deeper structures. The words proximal and distal are also commonly used. The proximal is closer to the trunk or the origin of the structure, and distal means away from the trunk or structure's origin. As in this image, the upper arm is near to trunk is a proximal structure, while hand is away from the trunk and is distal structure. Or we can say origin of a muscle is proximal attachment and insertion is a distal attachment. The dorsal term refers to the structures which are posteriorly present, and ventral refers to the anterior structures. And the cranial is a term used for the structures which are towards the cranium or the top or towards the head, while caudal is towards the bottom or the tailbone. So we have covered most of the common terms which are used in anatomy. Here's a quick review. We have discussed the anatomical position. A person should stand erect facing forward with arms hanging down, palms and toes facing forward. We have discussed the terms superior, inferior, medial, lateral, anterior, posterior, proximal and distal, the dorsal and ventral, and cranial and caudal terms. Hopefully, that will be useful and you will remember when you hear them. Thanks for watching.